Welcome to our new video where we delve into important health topics. Today our focus is on 9 signs of Polycystic Ovary Syndrome, or PCOS. You might be wondering, what exactly is PCOS? It's a hormonal disorder that predominantly affects women of reproductive age. It's a bit of a chameleon in the medical world, as its symptoms can vary widely from woman to woman. However, common threads include irregular periods, elevated levels of male hormones, and cysts on the ovaries. While the exact cause of PCOS remains a mystery, factors like high androgen levels, genetic predisposition, inflammation, and insulin resistance are often associated with its development. By understanding and recognizing the signs of PCOS, we can better manage and treat this condition. Stay tuned as we dive into the key signs of this condition, backed by scientific findings. Before we go any further, please like this video and subscribe to our channel. First, let's discuss the role of androgens in PCOS. Androgens, often referred to as male hormones, are naturally produced in everyone's bodies, regardless of gender. However, in some women, these androgen levels can be unusually high, a condition often associated with the development of Polycystic Ovary Syndrome, or PCOS. These elevated androgens can have a range of impacts on the body. For instance, they can lead to symptoms such as hirsutism, which is excessive hair growth, in areas where men typically have hair, but women usually don't. This could be on the face, back, or chest. Additionally, these high androgen levels can also contribute to acne, another common symptom of PCOS. While androgens play a vital role in our bodies, including in the development of male traits and reproduction, too much can have effects that go beyond what's considered normal. These effects can be both physical, like the ones we've just discussed, and metabolic, potentially leading to issues like insulin resistance. Now that we understand the role of androgens, let's move on to the signs of PCOS. Identifying the signs of PCOS is crucial for early diagnosis and management. Our first stop on this journey of understanding is irregular periods. This is one of the most common signs of Polycystic Ovary Syndrome. Women with PCOS may experience fewer than 9 periods a year, have periods that come every 21 days or less, or in some cases have no periods at all. This irregularity is due to an imbalance in the hormones that regulate the menstrual cycle, with PCOS often causing higher than normal levels of androgens, the so-called male hormones. Next, we delve into the realm of enlarged ovaries with cysts. This sign is, in fact, one that gives the syndrome its name. Many women with PCOS have ovaries that are larger than average, and these enlarged ovaries often contain a series of small fluid-filled sacs known as cysts. These cysts are actually immature follicles, each containing an egg that has not matured enough to trigger ovulation. This lack of ovulation can further contribute to irregular periods. Our third sign is hirsutism, a condition characterized by unwanted male pattern hair growth in women. This sign is directly linked to the elevated levels of androgens in women with PCOS. Hirsutism can manifest as excess facial and body hair, particularly on the chest, back, and lower abdomen. It's a sign that can be particularly distressing due to its visible nature and societal beauty standards. It's important to remember that these signs can vary greatly from woman to woman. Some may experience all of these symptoms, while others may only notice 1 or 2. Moreover, these signs can be influenced by various factors, including age, weight, and overall health. These are just a few signs, but PCOS can manifest in other ways as well. Let's continue with more signs of PCOS. Our next sign is weight gain. It's not uncommon for women with PCOS to struggle with their weight. You might be wondering why. Well, the answer lies in a hormone called insulin. Women with PCOS often have insulin resistance, which means their bodies can't use insulin efficiently. This can lead to weight gain, especially around the waist. But remember, not all women with PCOS are overweight, and not all overweight women have PCOS. It's just one piece of the puzzle. Moving on, we have acne. Now, we all know acne is a common issue during adolescence, but persistent acne could be a sign of PCOS. Here's why. Women with PCOS tend to have higher levels of androgens, the so-called male hormones. These hormones can stimulate oil glands in the skin, leading to clogged pores and, you guessed it, acne. If you're dealing with stubborn acne, particularly along the jawline or lower face, it might be worth discussing PCOS with your healthcare provider. Lastly, let's talk about hair loss. This one might seem a bit paradoxical considering we mentioned excess hair growth in our previous segment. But here's the thing, those pesky androgens can cause hair thinning on the scalp, a condition known as androgenic alopecia. This can result in a receding hairline or widening part, often causing distress and lowered self-esteem. Keep in mind these signs can vary from woman to woman. Some may experience all of them, others just a few, and some may show no signs at all. That's why it's vital to consult with a healthcare professional if you suspect you might have PCOS. We've covered 6 signs so far, but there are more to be aware of. We're rounding out our list with the final signs of PCOS. Difficulty getting pregnant is one of the more distressing symptoms for many women. This is often due to irregular or even absent menstrual cycles, which can make timing conception quite a challenge. Next, we have skin tags. These small, fleshy growths commonly appear in areas where the skin folds, such as the neck, armpits, or groin. While not harmful, they can be an indication of insulin resistance, a condition often associated with PCOS. Finally, there's acanthosis nigricans, a mouthful of a term for a condition that causes dark, velvety patches in body folds and creases. It's another sign of insulin resistance and is often seen in conjunction with other symptoms. Remember, these signs can vary from person to person, and having one or even several doesn't necessarily mean you have PCOS. It's always crucial to consult with a healthcare professional for diagnosis and personalized management. With these 9 signs, you now have a comprehensive understanding of how PCOS can present itself. Knowledge is power when it comes to managing health conditions like PCOS. We've journeyed through the 9 signs, from irregular periods to skin changes, all the way to difficulties in conceiving. Recognizing these signs early can pave the way for prompt diagnosis and treatment. Remember, you're not alone in this journey, and understanding is the first step towards empowerment. Did you find this information useful? Comment below. And before you go, thank you so much for watching our video, and please make sure to subscribe to our channel. If you want to give up alcohol, watch the video on your screen next. Finally, don't forget, if you want a kickstart or track your fitness journey, use our calorie and protein calculator in the description below. It can be your companion and accountability partner on your journey to better health.